do a good review.
It's just the appointment card. Julie, okay, talk on live.
Oh my God, she just handed this to me and I'm talking on live. So we've had a little bit of a crazy morning. Somehow somebody from the building maintenance people were screwing around on the roof with the heat and all of this natural gas pumped into the office. And it's one thing to have a blip of gas, but it's not good when you're an infusion patient. So anyway, we ended up moving our infusion patients outside for the rest of the morning, which has actually turned out to be a good day. So I tweeted out a picture because my staff is amazing. They are rock stars. I had my nurses and my infusion staff outside with patients' IV pools in their chairs and blankets, and we just got it done. And now the gas smell has dissipated, so we are back in business with patients back in the infusion room. So everything is good again. And here is Claudia, who is the mastermind.
She just sent me to a guy. She's great at getting me to do things that she wants. And she goes, Claudia, this guy wants to leave a review. Me, just not even thinking about it. I'm like, oh my God, this guy's so excited to leave a review. Let me go chase him down to give him one of our appointment cards that has a QR code on it for him to leave a Google review because he wants to so bad.
So do you need me in here or no?
You sounded a little fired up, so I was like...
So I am a little fired up.
You have a couple things you could talk about?
I do. I would like to talk about a couple things.
People have missed you on the live. Usually it's me crocheting.
Okay, so here's the deal. I got a little swing in my step because I've got some traction with PepsiCo. It's might not be Pepsi No. It's still Pepsi No for now, but I at least talked to someone from HR at PepsiCo. And you know what they told me? They said, well, I've never done this before. And I'm like, well, buckle up, because I have. I've done it over and over again. And I got his email address, and I emailed him the information of what needs to happen to get this patient cared for. So we will see what happens. The PepsiCo HR person said, I had a couple of missed calls from you. I'm like, no. There wasn't a couple of missed calls. There were 4 voicemails. So
a TikTok, anyway. A couple tweets.
Right. So actually, I've got
Julie for president.
I've got renewed energy about these cases, and sometimes it can get really, I can get really down when they don't happen quick enough. But any little seed of somebody on the inside at wherever the insurance company is, or in HR at these self-funded companies, when they finally pay attention to me and they finally listen to what I'm telling them and helping their patients and their employees, that gives me renewed hope. So my Diet Coke and I are having renewed hope today, and yay.
She is a Diet Coke gal. So you want to kind of explain the difficulty, like how one of the barriers put in place with like copay cards?
Oh my goodness. So, manufacturers' copay assistance cards really are lifesavers for commercial patients. They really should be allowed for Medicare and TRICARE and all the other programs, but they're not. I don't know. Somebody at the top of some heap, politician, got it that nobody that has Medicare or Medicaid or TRICARE, our service members, can use a manufacturer's copay assistance card, which is complete nonsense, but that's just how it is. That's not going to get fixed in my lifetime. But these copay assistance cards essentially will cover the patient on the drug cost, whatever their insurance doesn't cover, which is not nothing. I mean, it is. So for $5, they can typically get infused if they have commercial insurance, and we can use a copay assistance card. So obviously we do all the legwork and help the patients get access to care, because it's really important that they get their medicines.
Do you have any advice for dealing with Optum? They're awful.
All of the PBMs are pretty terrible. Optum, Express Scripts, and CVS all just pride themselves on, offshore agents and not answering the phones. And I like to tweet out to them. This whole TikTok thing is pretty new to me, but I think we're getting some traction. And I think the more that we can spread awareness and educate and advocate for access to care, the better. I am super, super interested in helping our patients, and I don't know how to do it any other way than one patient at a time. Every one of these patients is medically complex, and they don't fit into one size fits all, or not even one size fits most. So, insurance companies and PBMs, they want to funnel everybody into one size fits all. They don't take into account anything other than their bottom line and their profits. So their formularies change typically once a year, so we're probably getting ready to see some other big jam job coming down 1/1/2024. But I'll be sitting here on ready with my clipboard, my whistle, and my positive can-do attitude, because once we have stable patients, we don't change them.
How do you feel about a non-medical switch?
So that's what I'm talking about. It's called NMS, non-medical switch. So if a patient is stable on branded Remicade, Optum might have gotten a bigger, better deal from one of the other biosimilars like Pfizer's Inflectra, and they want patients to just automatically switch off branded Remicade to Inflectra. So there's a couple problems with that. First of all, Inflectra is a loser drug. And if anyone's paying attention in the doctor's office and they're infusing Inflectra, that doctor is writing a check for that medicine. It's about $400 an infusion that the loss is, at least this quarter. It'll probably be higher next quarter. So I have 0 Inflectra patients, but I don't do any non-medical switches because they are not the same medicine. If a patient is stable, whatever medicine they're on, if it's an oral medicine, if it's a subcutaneous medicine, if it's an infusion medicine, whatever they're on, they are staying on in this office.
Why?
Because these are medically complex patients, and we will have to change them eventually, because not everybody is going to be stable forever on the same medicine. But we are not making a non-medical switch because some insurance company needs to make more profits, or some PBM needs to get another private plane. It's not happening. And the other thing is, these insurance companies and PBMs, they change their formulary every quarter or every year based on profits to them, not care for the patients. So doesn't matter what it is, non-medical switches are a non-starter here. Not doing it.
Oh, that was good. That got me. I'm trying to think. What had me fired up earlier?
It's always something. Oh, you know what? You were trying to get a patient
to pay
his insurance.
So there was a little bit of confusion. My friend forgot to pay for a couple months.
A patient.
And he owed $1,400
to United Healthcare or United Health Cartel.
That had to be
your choice.
That had to be paid by tomorrow. This old man was on the phone for over an hour, he said, and he called me and he's like, Claudia, I can't get anyone to take my payment. And I was like, well, that's weird. Usually, I'm surprised they're not knocking at your door for it. You're going to have to pay it back one way or another. So then I'm trying to figure out how to 3-way. She's yelling at me. And
that's what I do.
Finally, I got on the phone, hung up on. So I left a review because, yes, I am that person that leaves a review. All zeros, because nothing worked. Even my friend was mad. And then we called again, got the same lady, but she said it was her first call of the day, so it wasn't. And then she tried to process the wrong amount to reinstate his policy. It was $1,400, and she was going to process $200. And
it's the classic move, which luckily we've got staff that can have the time to help our patients. But this patient is like 78 years old, and he can't get United Health Cartel on the phone to make his payment. Okay, like seriously, another barrier. Usually United Healthcare and all the payers are all about getting a payment, but when you have to get your doctor's office advocacy person on the phone to do a 3-way call to make a payment, like this is next level cray-cray. Not having it.
Do you think doctors have anything to do with the increase in drug cost towards the patient?
I don't think so. If anything, we're getting, physicians' offices are getting paid less and less every year from Medicare. We're going to get another 3.5% pay cut on 1/1/2024 because some bonehead at Medicare, which is probably in some puppet role from an insurance company, has decided that physicians independent physicians need to have a 3.5% pay cut this year. So hospitals, they get whatever they want. Independent physician offices, not so good.
Oh, it's backwards. Someone asked what diseases we treat.
Oh, yeah, it is.
Any autoimmune.
So the primary diseases we treat are rheumatoid arthritis, psoriatic arthritis, reactive arthritis, ankylosing spondylitis is a huge one. That's arthritis of the back. And then we've got your lupus, your well, we do some Crohn's, but there's a lot of crossover. The psoriatic arthritis and the ankylosing spondylitis can really look like other diseases. But when you've been doing it as long as Dr. Bach, we can get you a differential diagnosis about minute 21 of a 45-minute new patient appointment, and let's get you started on treatment. We don't need to waste a whole year trying to get your diagnosis. We're starting today.
Well, and we were actually thinking about offering direct care virtually if you don't live in Missouri. That way you can get examined by our world-renowned doctor. We've had patients from Norway
fly in here to be seen by Dr. Bach from another country.
We changed Shayla's life. She said, get in there. She has my dog right now. That's how much we love our patients.
Yes, we do really love
If you
our patients.
go all the way down on my TikTok, it's a video of me and my dog. I wouldn't just give them to anyone. So I think that in itself shows the relationship we have with our patients. Insulin stressed, and I'm sorry, I don't speak that.
Well, I'm going to get
Do
back
you
to
treat
work
patients with rare autoimmune diseases?
all day long. If you have an issue that no one else can diagnose, that is our wheelhouse.
You have to keep
okay? We need anything that is like unknown ends up in a rheumatologist's office. This is not some textbook recipe of how we treat patients. Dr. Bach has a patient that has stiff man syndrome, which oddly enough, Celine Dion has that. We've been treating her for a while, and we're going with an out-of-box treatment. She's on rituximab, infusions every 6 months. We've had 3 cases of CIDP, which is a chronic demyelination that has patients that are completely normal functioning that quickly takes out their ability to walk. So if you look back at our old Twitter, I had a patient last year that was a patient that they kept denying her IVIG, and of course, after gnashing of teeth to powder, I think I worked on that case for about 4 weeks. We got her treated. She was in a wheelchair. She was 41 years old. Her dad brought her in here, and she had suddenly lost the ability to walk. But Dr. Bach diagnosed her. It was about a month delay because of her dumb insurance company, but we treated her before the end of the year, so I knew that they wanted to push her into the new year so she'd have to pay more. I'm like, that's not happening. We're getting this done in 2023. So we got her 5 treatments in the end of 2023, and she is doing amazing. So somebody like a rare patient, like a rare disease patient like that patient, she becomes a Dr. Bach only patient until she stabilizes. So Dr. Bach saw her for, I'm going to say about 9 months before he kind of turned her over to the mid-levels, but she is amazing. She's actually writing a book about the experience. So shout out to my good friend who looks amazing and, got to put the wheelchair in the trash.
We love
That's the kind of rare diseases. Anything weird, rheumatology is here for.
You have 939 likes.
Oh, yay. Okay, I'm going back to work.
She acts
Thank
like
you.
this doesn't work.
This does work. Bye, fiddlesticks.
That means the F word.
There was 900 likes on that?
994.
That's amazing.
I know.
How many followers?
Well, I haven't given it up yet. I'm obsessed with you. Thank you. I was like, Julie, we can't stop. Karen, come here.
Karen, you're looped in now.
Oh, no. Oh, wait, she's a spy. She's a spy. Okay. So that was a talk with your guys' cult leader, because I guess the C got kicked off the money. 636. But now we're here live with Kristen. Kristen, what are we working on?
Billing for diagnostic ultrasounds.
Where'd you get this new pen?
Did you not get one?
I didn't get one. So something I think needs to... Hey, psychotherapist in Phoenix, Arizona, and you guys rock. I love my therapist. Jason, shout out to you if you see this. My therapist literally saved my life. He is the best, and I tell him all the time that we're going to change healthcare because he deals with a lot of VA patients and our veterans, and we just need to fix their care. I wish y'all were closer. Where are you? Hello? It's me. She's never this quiet. Alabama, by the beach. I gotta get something. How to earn a points. Set a life goal. I love that you can just see my facial expressions. People don't realize lives get traction. Ooh, and it makes me look better than I look. I was so happy to find y'all. I fight insurance for chemo.
Daily.
Texas? Or chemo treatment. I'm an idiot. Oh, God. Please ignore that. Treatment. What an idiot. I swear. Up is down and down is up. Today's been a day. We thought there was a gas leak and, brains all over the place. Love your page. Very eye-opening. We hope to be. Very transparent would be the name. What do you do, Kristen? She actually just got back.
I do diagnostic ultrasounds here in the office and assist with all injections.
She acts very awkward. It's so strange.
Yeah.
You just act like it's your friend. We've known Liz our whole life. What's going on, Liz? How are you? I don't have any kids, You just gotta throw out random facts. She actually just got back from Texas. She is our diagnostic ultrasound tech. So we do a lot of diagnostic ultrasounds to assist with diagnostic diagnoses. God, I shouldn't even. Did I take my medicine?
I don't know. That's my credit card.
Why? She's never this quiet. I swear on my life.
I don't know what to say.
You just talk. We get 2 training calls. That's interesting for me. Kristen pierced her nose with a needle. If I knew how to share it, I would. You're not even in it and you're acting awkward. Now you're in it.
You see how I just corrected my face?
Yeah, no, it does it to me and it makes me look better. I'm not. I would like to say I'm this cute, but I'm not. So, do you have a lot of I got you a Christmas present. Ooh. That's Shayla.
Oh.
Yeah. See? It's your friends on here.
I love Shayla.
Yeah, see? Look, she's warming up now that she knows you're here, Shayla. Golly. And the present's for me or Kristen? Hi, Holly. My last name's Holly, so if we got married, it would be Holly, because you'd have to take my last name. It's have a holly jolly
I was literally
Christmas.
just thinking that.
It's the best time of the year.
Will you peek from here?
No, I get scared doing that. I think she's talking to C.
Do I?
I highly doubt she knows you. Liz. She's gaslighting now.
Is that the bones that you
He's the best.
I
Wow.
know, you brought your bone. He said he was gonna bring her one yesterday, and she loves it. She loves it.
Oh,
Should finish half. I see my dog.
So small.
Damn,
Mm-hmm.
it's no way.
why?
I thought she's not strong. It's maybe.
My dog's got weak teeth too.
Your dog's small too.
Well, she's. I don't know if she brushes them every day.
I don't think she does. Buddy definitely does not. Is it good? Is it good? Did you say thank you?
Who did I send an invite to? Ziggy need a toothbrush. Yeah, that dog breath and a Tic Tac and some spray. Top it all off. That dog's breath smells.
You want to that one too?
If you want to, I haven't been really busy today.
Oh,
Thank you so much. I appreciate you.
She's never that nice. This is actually the meanest girl in our office. If I,
You're gonna get everyone to hate me on TikTok.
am I a kindergartner? Oh, I think I was making bunnies.
You want half of this?
Yeah. Dr. Buck sent thumbs up. You did not drink half of this. This was like the time I got alcohol poisoning in college. I drank 2/3, sorry.
Oh, I was like,
Me
where's
hit
my
me
drink?
annoyed.
There you go. Hey, Regina, come in this way. As eyes.
Ooh, we love that.